Secondary nephrotic syndrome. When nephrotic syndrome occurs as a part of systemic disease or is related to drug or other toxin, it is called secondary nephrotic syndrome. Systemic disease, drug, toxin. Important causes are systemic disorders like, for instance, IgA nephropathy, PSGN, post-streptococcal glomerulonephritis, drugs, infections like HIV, HBV, HCV, okay, hepatitis B, hepatitis C, human immunodeficiency virus, and malignancy as well. Mm-mm. Yeah. Okay. So secondary nephrotic syndrome அவ்வளவுதான். Moving on to congenital nephrotic syndrome. Infants who develop nephrotic syndrome within the first 3 months of life are considered to have congenital nephrotic syndrome. We know the cases of the clinical features of nephrotic syndrome like edema, massive proteinuria, hypoalbuminemia, edema, hyperlipidemia, lipiduria, and one more, hypercoagulability. So these are all the nephrotic syndrome features. Congenital nephrotic syndrome is just nephrotic syndrome occurring in a baby who is less than 3 months old. Okay, most common cause of this is Finnish type of congenital nephrotic syndrome, which is AR, autosomal recessive. Okay, so two most common genes are involved in case of congenital nephrotic syndrome. We call it NPHS. Okay, NPHS1 and NPHS2 are the gene names. NPH is probably nephrotic and S is syndrome. So nephrotic syndrome 1 and 2. So NPHS1 is coding for protein nephrin located in the slit diaphragm. It's located in the chromosome 19q13. Okay, disease is called a Finnish type nephrotic syndrome. Okay, NPHS2 is coding for the protein podosin. It's located in the slit diaphragm. The chromosome is 1q25 to 31. Okay, so 19th chromosome வந்து NPHS1, NPHS2 வந்து first chromosome. Okay, so NPHS1 is 19q13, 19q13, but the NPHS2 is 1q25 to 31, so like 25, 26, 27, 28, 29, 30, and 31. Nephrin and podosin in that order. Nephrin வந்து Finnish type of nephrotic syndrome, and podosin வந்து it's for steroid resistant nephrotic syndrome. Yep, so that is about nephrotic syndrome. I think we're already done with like nephritic syndrome, but okay. Yep, thank you.